This project was a collaboration with the Center for Media Engagement at the University of Texas at Austin, Ashley Mudeman and her team at the University of Kansas, and Jeren Budak and her team at the University of Michigan. We were looking at transcript coverage of the coronavirus on cable network news and the national broadcast news. What we wanted to understand is how they covered the coronavirus and whether there were differences across the various networks. Today we're joined by Mark Gibson, who funded this study. Mark, thanks so much for joining us. Why did you think it was important to fund this research?
Well, it's a great question, Talia. In the past, the American media has challenged both parties to be fair and reasonable and accurate in delivering information to the public, whereas now the media is aligned via a party line. And so we have a dual concern here between the political parties putting party over country and over health, and the media companies putting profit over public health. And neither one of those sit very well with me, because I think if you politicize the country, you're dividing us instead of uniting us, which is what we need to be doing through a crisis like this. So I set out to find the most competent expert in analyzing the news networks. I didn't want to go off public opinion. I didn't want to go off various surveys that I had read. I wanted rigorous academic research that is unassailable.
What worries you about the way in which national news and cable news programs are covering the coronavirus?
The fact that the news networks know that if they have fear in the public, their viewership increases, so their advertising dollars increase. They know that. They also know that if they advocate for polarization, that their clicks and their viewership goes up, which means their advertising dollars go up and profits go up. Hopefully, with this study and what we're funding, we can at least begin a process of returning news to news. Tell the audience what you found in your study.
We wanted to understand whether there was anything in the coverage that would indicate some form of politicization. So we looked at the words and entities and people mentioned in the coverage. And what we found was that on CNN and the broadcast network news organizations, they were more likely to talk about health officials and experts than they were to mention partisans. But the opposite was true on Fox News and MSNBC. On these two networks, they were more likely to talk about partisans, using partisan words, mentioning partisan entities and partisan organizations, than they were to mention health officials and experts. When we dug more deeply, what we found was that on Fox News, they were more likely to talk about Democrats, and on MSNBC, they were more likely to talk about Republicans.
What type of language did you find that was used?
We examined whether there was evidence of sensationalization or politicization in the coverage by looking at the words used. On Fox News, they were more likely to use words associated with possible treatments, like azithromycin and hydroxychloroquine. Fox News was also more likely to talk about China and the origins of the virus. MSNBC, on the other hand, was more likely to talk about the scale of the virus, using words like outbreak, pandemic, and crisis. These indicate incredible differences across the networks in terms of how they're discussing coronavirus.
And Talia, another question I have is, what type of fact sets were utilized in the programs that you analyzed?
We investigated the factual claims contained within the coverage throughout our study period, which ran from January to June of this past year. This is bookended by the first case of coronavirus in the United States and the 2 millionth case of coronavirus in the United States. And what we wanted to understand is, how were facts presented across these networks? Partway through this time period, the CDC released their guidelines that people should be wearing masks. What we found is that after the CDC announcement, all of the networks included more correct information about wearing a mask. However, all of the networks still had segments that included only incorrect information about mask wearing, and Fox News was least likely to include correct information about wearing a mask. What do you think needs to be done?
Again, I in no way want to harm the media companies. I don't want to harm shareholders. I don't want to harm the hardworking people in any of the networks. I want to change it. And I'm just looking for accuracy and integrity back into the media. One is that label your news networks opinionated and biased when they are, which most of them are, and then label news an unbiased news source that people can rely on for fact-based information. Number two, it is doubtful that they will change because what they're doing today is profitable. So how do you advocate change? Well, they're publicly traded companies that are driven by profit. So what drives profit are advertising revenues. We have identified the advertisers who either unknowingly or knowingly, they've enabled this to occur. And then finally, the last practical step we can take is the largest shareholders have been identified of these companies. And they, again, knowingly or unknowingly, are enabling this type of behavior to exist so they can vote shares and have a tremendous impact.
Our hope is that doing this research provides information to the public about what they're getting in terms of coronavirus coverage. It does matter what network you tune into, what story you're hearing about the coronavirus. And the more that we share this information about this politicized and sensationalized coverage, the more we hope that this will empower members of the public to think very carefully about where they turn for news.